evening and address you just briefly on the healthcare issue. Number one, take the town halls to Washington, D.C. If there is nothing else to do, take the town halls to Washington, D.C. I don't know what it is about no that these people don't understand, but they just don't get it. Starting with the uprisings last August, I think members of Congress were absolutely bowled over by what they saw coming from the heartland of America. They came back to Washington, D.C. in September. We thought that we had captured their attention, but they forgot once again. They got here under the bubble of Washington, under the thumb of Speaker Pelosi and the thumb of Harry Reid, and within distance of President Obama and Rahm Emanuel, and we saw them cave one by one and think, oh, I guess it's possible to pass health care. But then they heard from all of the folks back home. And the folks back home said, hey, don't you remember what we told you in August? We said no dice on health care. And then once again, we saw Speaker Pelosi want to bring the bill up. So what happened? We extended an emergency House call on Congress. Come America, pay an emergency House call on Congress. People from all across the nation, from Alaska, Hawaii, spent their money to do what? Fight their government. This is almost impossible to believe that for nearly 14 months the American people have had to be suited up to fight the government that was put into office, who is no longer representing the will of the people. We just heard that from Mark Skoda. He said CNN came up with a poll that said clearly 3 out of 4 Americans want us to start over with health care bill and not and the American people are right. For so long, I've been trying to tell my fellow politicians over here under the dome in Washington, D.C., listen to the people. Listen to what the people are telling us. They are right. They don't want the government to take this over. How do we know they're right? Because we know from some of the basics of the bill. President Obama's own economic advisor, Christina Romer, has said, if this job-killing government takeover of health care bill passes, 5.5 million people will lose their jobs. Now think about that. We've had a little struggle the last year with job losses. We're hovering around 10% unemployment, and we're actually contemplating passing a bill that would add another 5.5 million to the unemployment rolls. This is madness. And then what about who is going to be hurt? The other thing that we know in the bill is that $500 billion will be taken out of Medicare to go to, quote, pay for this bill. Well, who's going to pay for the bill? Senior citizens are going to pay for this bill because they'll have $500 billion less at their disposal, but 30 more million people will swamp the boat of the system. So think of what that means for someone who's 65 years or older. $500 billion less for their care, 30 million more people asking for care, no more doctors in the system. This isn't too tough to figure out that access to quality care is going to diminish rapidly.